Good. Okay. Let's do gloving first. Do this first. Okay. So, you know, we talked about, what's the other word for sterile? Something that's sterile? What type of asepsis? Surgical asepsis. Okay, that's like your sterile technique. What's the other one? Medical. Okay, now gloves. Now, I know that y'all's are open. Okay. That's just because I like to reuse them as much as we can, so I don't have to buy new ones every year just to do this one time. Okay, but normally, obviously, they come and they're sealed. Okay, and so what that it says on the outside, one sterile pair of gloves. Okay, what that means is that everything inside this package is sterile. So I'll kind of show y'all. Let me show you. Let me get something else too. Let me actually, before we do that, let me show you guys kind of how a sterile procedure works. Okay, this is just a kit to put in a Foley catheter, which is your normal catheter that drains your bladder that stays in. Okay, this is how it comes in a package like this, and so everything inside again is sterile.
What's that look like?
I'll show you. Okay, now when I take it out, okay, you know, I would want to wash my hands before I did this, but okay, at that point, this outside portion that I'm touching is obviously not sterile anymore. Okay, because my hands, you can't make your hands sterile. You just can't do it. It's not going to happen. Okay. So what I want to make sure of is that everything in here stays sterile, and this goes for any kind of sterile procedure. So it doesn't have to be just putting in the. There could be. There's other sterile, like wound care. Some wound care is sterile, not all of it. Kind of depends on what you're doing. Anyway, so I want to make sure my hands are not sterile, so I don't want my hands to touch anything that needs to stay sterile. Otherwise, it's going to be contaminated. What's the other thing I don't want to do once I open this up? Turn my back on it. They also say that if you bring anything below your waist, it's not considered sterile anymore. It's just kind of like a.
So that would not be sterile.
Well, it's on this tray, but I guess it's like anything. Like if I'm, that's why, you know, you see them on. They always have their hands up. Yeah. I think it's just like instruments and stuff. If I pull them down, I don't know if that's just because you run the risk of. I don't know. Anyway, but this is. This is just a short table, so it's not really a big deal. Okay, so one thing I want to make sure of is that I don't get anything on here that's not sterile. So one thing that you do whenever you're opening up a sterile field like this is I want to make sure this back is always not going to be sterile because that's what I'm just going to lay down on, but the inside is. And if I lean my head over here on my sterile field, now what have I run the risk of doing?
Drop it in that water, spinning.
Okay. Right, so I want to bring my arm around and I don't want to necessarily lean over it. Now, one thing to know is that once I've got a sterile field like this, okay, you can consider the outside like 1 inch border not sterile because you've got to be able to move it around a little bit, but you don't ever want to touch in the middle anywhere. Okay, so I can consider that not sterile. Okay, so now, again, all this is sterile. And this has to be a sterile procedure. Otherwise, I introduce bacteria into their bladder, and they get a bladder infection. And that's not good for anybody. Okay, this is just a drape. I can go ahead and take this out. Typically, this just kind of goes like underneath their bottom. And it's not going to be sterile because they're not sterile. The other thing that you'll see first in here are a pair of sterile gloves. So I can take these out. Now this is not, the outside of this is not sterile anymore because I've touched it. All of this is still sterile. So I would go over to like a side area to open these up and get them ready to put on. But I want to make sure the patient's ready first because if I put my sterile gloves on and then I touch them, I've got to put new sterile gloves on. Okay, so I don't want to do that. Now, and you guys can go ahead and open yours up if you want to do this with me. Okay, so you've got, it always comes, they come in a package kind of like you guys can see. And once you open these up, Okay. Yeah, these are large ones. You want to try them?
Well, I get real sterile ones.
They're powerful. So, anyway, so once you open these up, they've always got these cuffs on them. Okay, and that's so that you can touch them without actually touching the gloves. Now, once you put your gloves on, let's think this through for a minute. What part is going to be not sterile?
The inside.
The inside, right? Because that's what's touching your hands. Okay, so when you open these up, you can just open them up using those little cuffs. Go ahead and remember the 1-inch border around the outside is not sterile, so you can touch that part.
Oh, this is exciting.
If you'll open up those, whenever you open it, if you'll take those cuffs themselves and kind of open it, and you can a lot of times straighten them out.
Yeah, I did that.
Okay. Okay. So what part of these can we touch?
The cup.
The inside. That's why they always come cuffed, just like this. Sterile gloves will come already cuffed. Now, I always put it on my dominant hand first because my left hand is like, it just doesn't do what I want it to do. So,
if it's sterile and you touch like your glove, can you touch the other sterile part?
Yeah. Okay, so what you want to do is I'm going to take the one, somebody put these in here really weird.
But these aren't really sterile, though.
They're not anymore. So,
But we're practicing like that.
but they work. I have some packages of real sterile ones. Anyways, so we can touch the cuff. So pick up the cuff to your right hand.
Oh, what?
You can touch the inside cuff. I think I have 2 left gloves in here.
Yeah.
Does anybody have 2 right gloves?
How my hands supposed to fit here?
Who has 2 right gloves? Me. I'm here too.
Look at my
Somebody-
glove.
I wish my glove was purple.
How my hands supposed to
Are mine 2 right or 2 left?
Okay, but now you only want to pick up one at a time.
fit? Okay, now what?
You shove your hand in
Wait,
it.
I feel like this was still a left glove.
Right.
I need to turn my glove.
No, I had.
No, bro, that's your right.
No, it's not.
Okay, I don't know. Whatever.
Well, what's the difference?
mean, it's just
Well,
the
it
thumb on
kind of
the
is in
inside.
front of it
Yeah.
a little bit, so I'll just put this one on, even though it's going to look weird.
Mine smell like cinnamon.
Okay, so you can touch the cuff, and then you just put it on, okay?
It's not like the.
I feel like sterile gloves do have a
I don't
right
think
and a
these
left.
fit me.
Maybe they don't. Maybe it's this one's
Oh
just
my gosh,
this
I'm
one.
gonna touch the outside.
Oh my
Okay,
God.
so again, you don't want to touch the outside. Once you touch the outside, then you have to put them back and get a new pair of sterile gloves.
Okay.
Okay.
Wait, hold on.
Oh my gosh, I can.
Yeah, this is definitely a left glove.
Yay!
They are made.
Sterile.
Okay. Now, yeah, but look, you're touching the outside.
I'm not.
Now you don't want to touch the outside at all.
Ew.
Okay. Yeah, mine is definitely the wrong. Look at it.
I can't get
So
this
now,
No, this is
yours is definitely not sterile anymore.
on. You think?
Mine is sterile. Like I can touch them.
Okay. So,
I think that's the thumb.
so once you get that on, okay, now what part of this other one can you touch?
The whole thing.
The
You
outside.
can touch any of them
Oh, it
because you
hurts.
haven't touched it yet, so it's still all sterile.
Okay.
So the way to put this on without using your sterile hand to touch your not sterile hand is to grab it inside of the cup, kind of like this.
Yes.
Just grab it out of there, just like this. Kind of hold it for a second. That'd be easier if y'all stood up actually and did this. Makes it less likely to hold it. You're gonna have a hard time. Better put it back down and hold it like this. See? No, other way.
No, like get like
No.
flat.
Oh.
Inside.
There you go.
Are we gonna practice this?
Okay.
More than one?
Essence, I think you need to try yours again. Put it back down on your sterile field.
Look,
Okay.
it's like a little.
No,
flat.
just turn your hand over.
Oh,
Yeah.
that's right.
No. So you just lost your sterile again. Did you touch the outside of it?
Right.
Inside. Go inside.
Oh.
There you go. Now, okay. So then just take your other hand. Make sure you don't touch your not sterile hand to your sterile hand glove, and just put your hand in.
Oh my gosh, this was so much easier. I actually
Now-
did it.
This happens a lot. Okay.
Yes, that's what happened to me.
Oh my God.
But now it doesn't matter because both hands are sterile, so you can touch that one all you need to.
I'm so glad you do that.
Can we do it again one more time?
And I just touched my arm. Right.
Is this my
Then you
doctors
might
don't wear
end up with
jackets?
maybe you have two right gloves. Maybe that's your problem.
No, I think my middle finger's in the front.
I'm practicing one more time.
That's okay because now you can touch the outside of it, so it doesn't matter.
Go like this.
Okay.
Go like this. Go.
Yeah, this one feels
So-
We're
good.
gonna practice taking them off.
Now let's talk about how you take off gloves.
Oops, sorry.
Okay.
Johnson.
Yeah. See that is a.
I think he's like.
You
Move
have
right
to. Yes. You're
Here,
right.
let me doctor you.
It's not sterile anymore, man.
Are you ready?
What?
Are you ready?
To doctor? So I stay sterile?
Okay.
Come on, say it.
Oh wait, no. This one's left also.
If the doctor wears a watch, they pull the
Oh,
plug
yeah.
over
Tell
the
me what
watch.
your gloves going on.
You guys have fun.
Okay. Anyway,
Mine is yellow.
Oh, God.
wait. This is right.
Okay, what now?
No, it's not.
And this is all sterile except for 1 inch. Oops, touched an inch.
Okay.
If my patient gets a bladder infection, you know,
Okay. So, this is so weird. So, anyways, the way that you get these off, okay, now if we've done our wound care or I've started this catheter, now what part is contaminated?
The whole thing.
his glove farted.
The outside, right?
And
the
the
outside because it's got blood or body fluid on it,
Ew.
okay? Probably urine and other body fluids.
Ew.
So, the way I want to take this off is one, I want to make sure that I don't touch it with my skin. So, take it off, pull from the inside, right here. Okay,
That feels cool.
and
Yeah.
just pull it off. And don't stuck my line right now. Okay, now once you do that, roll it up in your hand that's still gloved like this. Now, again, what do I not want to touch with this hand?
The
The
out-
outside of this glove because it's got
inside.
nasty on it.
Hey,
So you can just touch the inside with your fingers and just kind of take it off inside out.
I don't know how to do that.
So now just the inside is what's on the outside and you can roll
This
it.
one's yellow.
I'm doing this again, Miss Bird. I
I'm
gotta
doing
learn.
it here. Okay, since I've got weirdo gloves, I'm doing it here.
Yeah. Don't smell your hand. Ooh, smell like balloons.
Yeah.
Okay, I don't know which is the inside, which is the outside.
So do you like take this apart now?
Okay. Yeah.
Let's do it again.
Well, I mean, these were sterile.
Are these still?
Yeah, they're not.
Oh. Chrissy, we shouldn't get started. We make it sterile.
My whole life is sterile.
So yeah, you guys can try it again.
You guys like make sure you fold the little cup thing down.
Yeah.
Because we're doctors now.
Does anybody else have like
It's a little harder to stay sterile though than you think, isn't it?
Yeah, like I
Like stuff
feel.
on hand.
no like
So, if I'm a nurse, I can touch
Are
the
you-
inside.
I used to like it.
let me see your
Yeah, whenever you put it back, just make sure you cup them.
Oh my gosh, I'm a winner at life.
Did you put gloves on?
Yes.
Now, let me see yours real quick.
you.
Let me show y'all this real quick. Okay, let's say I got stuck and I accidentally touched something and I had to get rid of my gloves, but I don't have any more gloves in the room. Okay, I don't really want to waste my whole kit, so I don't want to go get them. I'll go over here to the phone, call someone, hey, can you come bring me some sterile gloves? Of course, I guess they could just bring them, it wouldn't be a big deal. But let's say I lost something else in here, and I already had my gloves on, but I needed something sterile added to my field, and I didn't want to take it. The way to add something sterile to a sterile field like this is you just open it and you use.
You walk away.
Add things in it, so that you don't break. Okay, so I'll give you guys a couple minutes to.
I'm getting pro at this. You don't even know.
Yes.
Miss Bird, I just did this sterile.
I'm missing a finger.
There we go. I'm about to do my sterile one.
Off, ball it up, and inside, ball it. Oh my gosh, that could be a third.
Oh my gosh.
Now, if this something like this happens, on your hand that you haven't fixed yet. You just gotta live with it until you get your other one on.
Oh my lord.
Anyway, they blow it and then they roll it and then
I
Aaron's
didn't get it
or
yet.
Essence just farted.
Okay.
I put mine on back.
I'm gonna practice more.
Oh, I could put it in the wrong finger.
If that happens, go ahead and put it on as best you can.
So
and
you
then
can
get
only-
your other one on.
You only touch the cuff part.
Yes, with your hand. And look at this. Once you touch, here's the only thing about what you just did. Oh! Once you touch the inside of this, the whole thing's not sterile anymore. So when you touch it, just pick it up like this. And put it on.
My ring gets caught.
Okay. My fingers are stuck.
Yeah, okay, I can't do it with a ring on, so I'll just never wear a ring and I'll be single for the rest of my life.
My mom had to get a new wedding ring because hers was too big, so when she started nursing, she had to get it.
I just usually wore my band. I didn't wear my engagement ring too.
Okay, practice. Woo.
Even though I got one
There we
that's pretty
go.
flat.
My
so
mom
I could
takes
put it
hers
on.
off and puts it in her pocket. Then when she's done, she'll put them back on.
That's serious.
I wouldn't.
Oh, yeah.
I couldn't do it. Okay. Okay, so let me show y'all kind of how this procedure works.
Ooh, I want to have my
Okay, this is called a fenestrated drape. Well, I don't ever actually use these, but you can use them to lay over the area, and then you have sterile field to work around it. Okay, so a catheter, this thing comes with, remember this all is sterile, and I've got everything is sterile. So it comes with the bag
Whoa,
in
that's
here.
a pee bag.
Isn't that one like people can't like do?
So this is for people who can't urinate.
Okay.
Okay, and so, and this is the actual catheter itself.
That goes
Go
inside.
with the blue.
Mm-hmm.
Oh,
No,
gosh.
this goes into the urethra.
Wait, that must hurt.
Okay, it's not too bad. Okay, so yeah, now the whole thing, it just goes in until it gets to the bladder. And here's how it stays inside.
Water.
Okay,
Save me.
there's actually, this is, I don't know if this is water or saline, but
You showed me this
It's
in
probably
7th grade.
saline.
Isn't it?
I kind of actually think it's sterile water. Probably says on here, sterile water. Okay, I always test it before I put this in someone to make sure that this bulb works like it's supposed to. But when you inject this, it goes in.
This was like busted.
No, this is what holds it in. So you put the catheter inside, and then you inflate this bubble inside their bladder, and this is what keeps it from coming out.
You gotta put the whole water in there, like you like.
You gotta put all the water in there.
In this bulb, yeah, all this is in here. It's in this.
Well,
And then
You
take-
showed me
then
this.
you take this out.
Won't feel it.
See, and then this stays, yeah. This stays inside. So that this little bulb helps to actually hold it in the bladder. It's kind of like
You showed me this in 7th grade and I thought it was a weird thing.
okay, now, so I know it works. It's not leaking or anything. So I'm gonna take this back out. Okay, I'll put this. Sometimes these are kind of hard to work with as far as keeping them sterile. Now, these have iodine swab. These are like little Q-tips that have like a really big swab on the end that has iodine. It's that, you know, it looks red, but then whenever you put it on, it looks yellow.
Oh, yeah. I have
Cleans
to.
it. And then this is lubricant. So like what I'll do is I would put this lubricant on my tray right here, and I would dip the end of this catheter into it and leave it there for a minute, and then I would use I'd get all this ready. So over here, my patient's over here. I'm gonna hold them with this hand. I'm gonna get all these out, and they're already ready, because once I touch the patient, then this hand's not sterile anymore. I'll probably do it on this side actually, because I'm right-handed. So once I start holding them, this hand's not sterile anymore, so I can only go back and touch this stuff with my sterile hand. So once I get them prepped and get them ready, I'm gonna make sure that I'm gonna get my swab sticks and use all 3 of them. Clean them, throw that one out, get the second one, clean them, throw that one out, get the third one, clean them, throw that one out. Then I'm gonna take my catheter, and sometimes, like I said, these are kind of tricky to keep them sterile, keep it a lot rubbery. I'm gonna bring this over, and you just put it in until you start seeing urine come into the tubing, and then you put it in just a little bit more, and then hold it, and then I push all my fluid back into the bubble so it'll stay inside. And you just take this out and then you leave it.
Have you ever had one pop?
Mm-mm. I have not. I mean, I'm sure. That's why you check it always beforehand, though, to make sure it's not going to leak or anything. Anyway, but it's kind of, sometimes it can be kind of difficult to keep everything sterile, you know, like it's supposed to be.
Probably it's easier the more you do it.
Oh, yeah. I mean, definitely. It's hard learning, especially with the catchers to me, because they're like, they just, you know, like go all over the place. So,
And you said you had to give catheters once to little boy.
I've sorry, lots, but no, that little boy, the one I think you're thinking of had an enema.
I heard those are like spas. You go to the spa for that.
Like a cleanse, you mean? Probably thinking that.
Aren't you supposed to wash the gloves before you use them?
No.
Because to get the powder off?
The powder's only on the inside.
Oh.
No, now if somebody's allergic to latex, you don't use gloves. You wouldn't use latex gloves. Like you use like nitrile gloves, like those ones that Abby has.
I'm always gonna use this kind of glove.
Most places these days you don't even use latex gloves anymore unless you're using sterile gloves.
I have a
Most
question.
places have nitrile gloves. Yes.
Do they have like cheetah print gloves?
I don't cheetah print.
Because if I had gloves, I would want like some,
Yeah, me too.
not just like.
They're like.
I don't feel bad.
Yeah, I want to still feel pretty. Like I
Yeah,
want to
after
be
you
cute.
spend all the money on medical school, I bet you won't want to spend the money to feel fabulous when doing the surgery.
No, yeah, girl, I will because
Should have plenty of money to do what you want, I guess.
I want
Oh, I
to be
didn't
cute.
put the gloves back in.
I want to go be
Okay, that's normal. Okay, we better get going. Let's talk about hand washing.
I just did it again.
Are we gonna put on like the gear?
Put all this back in there. Yes, we'll try to do that. If not, I will leave it. Let's talk about hand washing. You guys can be working on that. Okay, let's look first at, let's go over the PowerPoint real quick first. And then I'm just going to kind of go over this pretty quickly so we can get through it. So the PowerPoint looks like this first. So we know hand washing is like the primary way to prevent any kind of illness, sickness, whatever. But it's not a sterile technique. It is just a clean technique. Most effective way to prevent the spread of disease is washing. Okay, so it should be performed before and after every time you contact a patient. So on your way in their room and on your way out of their room. Anytime your hands become contaminated, obviously, before you put on gloves, after you take off gloves, which sometimes you do that anyways when you come in and leave the room. Before and after handling any specimens, so any blood, you know, any like tubes of blood or anything like that. You don't know, people, I'm just telling you, I've drawn blood a gazillion times, and there's times when blood gets on the outside of that. It just does, you know. Whenever you're not sure if your hands are clean. After contact with any soiled or contaminated item, after picking up an item off the floor, after you use the bathroom, obviously after you cough, sneeze, or use tissue, or after you any contact with your mouth or your eyes, any mucous membrane. Okay, you don't want to be touching people, touching your eyes, touching your nose. Okay, so ways to wash your hands. Soap is used as a cleansing agent, and pathogens get trapped in the soap suds and rinsed away. The soap itself, unless it says antibacterial on it, soap alone does not kill any bacteria. It just washes it off. So the important part of the hand washing is not even necessarily the soap itself. It's the act of washing with the soap. If that makes sense. As you use liquid soap when possible, just because, one, bar soap can hold its own bacteria on it, and two, you get a lot better lather with liquid soap than you do with bar soap. So use warm water because it doesn't damage the skin like hot, but then it creates a better lather. So you can use cold water and that's fine, but it just lathers a lot better if you use warm water. I know what I mean by that. They're going to get sudsy. And then hands should be washed for 10 to 15 seconds. That's what's recommended on our, that's what the curriculum says. I say 15 to 20 seconds. That's what I learned in school, and I don't know, you'll see it vary place to place. I put 10 to 15 in here because that's what the curriculum says, but as far as for me goes, it's 15 to 20. And then if they're heavily soiled, then for a minute. That's like if they're visibly soiled, you know, if they're heavily soiled, at least 1 minute. It says use friction to help rub off the pathogens. So it's really important when you are washing your hands that you actually scrub your hands. You know, getting a little bit of soap, putting it on, rinsing it off real quick is not going to do the job. Like I said, it's not the soap that gets rid of the bacteria, it's the scrubbing. All surfaces of the hands need to be washed. Fingertips should always be pointed down to keep the water from running back on your forearms and then bringing germs back down whenever, whenever that water runs back down with gravity. Dry paper towels should be used to turn the faucet on and off. When you guys do your quiz, I'm not going to count you off if you don't turn it on with the paper towel, because to me, I'm like, my hands are dirty. I know, but anyways, that's what the curriculum says. But turning it off for sure. Why do you think it needs to be dry?
Because it's the one turning it off and then
Right. If you use a wet paper towel, or if the paper towel that you're using, you've used your hands to dry and it's wet now, germs can easily travel through any wet paper. They just travel on through, no big deal. So that's why you always use a dry paper towel to turn off the water. Okay, says indication for hand hygiene. When hands are visibly dirty, if they're contaminated, like you know that you've gotten something on them, or soiled, wash with soap and water. So that's when you definitely want to use soap and water. When you can see something, there's something visible on your hands, or if you know you've been in contact with something. Okay, if the hands are not visibly soiled, you can use an alcohol-based hand rub for just your routine. But typically, once you get past, you've washed them several times with the hand sanitizer, and you get these little like peelies on your hands. You ever notice that? It gets like, so always just every once in a while you just need to wash them. Okay, hand sanitizer. We call it handitizer in my house. That's what I forgot that it was actually called hand sanitizer until I read it on here. That's what Handa's always called it. So, hand sanitizers work to kill microbes chemically. They actually kill the germs themselves because of the alcohol. This waterless hand sanitizer provides several advantages over hand washing with soap and water. However, they're not as effective if there's some kind of organic matter like dirt, something that you can see on them. So some benefits. They don't take as much time, right? What else? What are some other benefits you guys can think of?
Just carry it with you.
Yeah, carry it with you, right? You don't have to be near water and soap all the time.
Can't exactly carry your things. That's what I was about to ask you. Like the last time I went to the hospital, all I see doctors was like get hand sanitizer and like really wash their hands. That's what I have to ask you. Like,
What if they have ones they carry and they spray on their hands and they put back in the pocket? I guess they just
I'm like so anal about this. But yes, hand sanitizer is just as good as washing your hands if your hands are not visibly soiled or you know that they don't have something on. And if you do it correctly. But yeah, I'm always like, I'll put hand sanitizer on and then I put my hand sanitizer up and then I go back and scrub my hands. I feel like the outside of my hand sanitizer bottle is gross. I know, look at you can tell I wash my hands like 90-year-old woman hands. More accessible than sinks, like we said, reduced bacterial count on your hands. It actually reduces the bacterial count because it kills it. It doesn't just wash it away. Does not promote antimicrobial resistance. They're less irritating to the skin than soap and water. And then some can even improve the condition of your skin, like some of them have aloe or something in them. Usually using soap and water really dries your hands out. Says both components of waterless hand sanitizer and friction should be used to increase the effectiveness. So here's your steps on how to effectively use hand sanitizer. Says make sure all organic matter is removed from hands. So again, you can see something, you need to wash it. Apply a dime-sized amount of waterless hand sanitizer to the palm of your hand or use a wipe if that's what you have. Rub your hands together, covering all surfaces of your hands and your fingers, and then rub until it's all absorbed. Not until you can blow on it and make it dry, but until it's all absorbed. So just keep rubbing. Okay. And again, you want to make sure you get all of the surfaces of your hands in between your fingers, backs of your hands, wrists. Those are areas that sometimes we're not so good at.
Okay, I have a question.
Mhm.
I've seen antibacterial lotion. Could you use that?
I mean, I guess probably just have alcohol in it. So, okay, let's look at the procedure real quick. You guys can be practicing. I would encourage you to take this home with you. Practice this at home because come next week, I'm going to test you on. Probably Thursday. Okay, so number 1, remove your jewelry. Number 2, turn the faucet on with paper towel. Again, that's optional. Adjust the temperature. You want it to be warm if possible. And again, you don't have to have warm water. Washing your hands with soap and cold water is better than not washing them at all. Okay. I mean, when I was in Ethiopia, that's all we did. Only had cold water. There was no warm water. So I had the whole 3 months I was there only used cold water to wash my hands. It's fine.
What about showers?
Cold showers too.
Was it like in summertime?
No.
Oh, so a little hot.
It was like their winter is like, and during the day it would be in like the 60s, probably.
It was like a cool
70s,
breeze.
sometimes 70s.
I'll
Yeah, it's
die.
more like a wet, damp, nasty.
Louisiana.
It was cold. I mean, it was chilly. It wasn't like freezing or anything. And the reason we didn't have hot water was because our hot water heater had a solar panel on it. Well, it was the rainy season, so I think there were like 6 days that the sun came up the whole 3 months I was there. It was cool. We warmed up water and put it in the bathtub sometimes on the stove. Okay. It says wet hands and wrists thoroughly. Again, fingertips pointing down. That's going to be pretty much the case the whole time. Apply soap to get lather on hands. Put the palms of your hands together and rub them using friction in a circular motion. Again, 10 to 15 seconds. Okay, everybody practice. Circular motion, lots of friction. Okay, go like this. Okay, now it says interlace your fingers on both hands. Rub them back and forth. You can hear my hands because they're so dry. Clean your nails. Now, anything else you read, it's going to tell you to use a nail brush, but who carries a nail brush around with them to wash their hands? Nobody. Okay. So I always just do like the palms of my hands and my fingernails to get stuff under. That gets soap under your fingernails. And then rinse your hands with your fingertips pointing down. Dry your hands thoroughly. Look at this, from the tips of your fingers to your wrist. Why do you think that is?
Clean.
Clean to dirty, yes, because your wrist is not going to be as clean because that's not what you've been scrubbing. Okay, so I always do this. This is one that people miss all the time, and I don't have a towel. But I always just, when I'm drying them, if I'm going to go tips of fingers to the wrist, I just start up here, dry each side like this, and then I just move back down to my wrist. That, to me, is the best way to do that. Because what ends up happening is people do this with their towel. Okay, and then all the germs that they missed on their wrist, they're just pulling it back up to their fingers again. Turn the faucet off with a dry paper towel and then put it in the wastebasket. Avoid touching the inside of the sink. Okay, now my suggestion is that before you ever even start washing your hands, you let down your paper towel so you don't have to touch the paper towel holder. Because you know it's got germs on it. And some people just put their hands in the water and then they go and get them a paper towel.
So we need that rain for lotion on it.
Does everybody have soap in their bathrooms right now? That's the next question. Every year I have somebody like, we never have soap in the bathroom. So, okay. Well, that's that. Practice this, though. Be practicing every time you begin.